When people ask how much do braces cost, it can be a little bit misleading because in orthodontics, you are not buying braces. The key thing to understand is this: orthodontics is not a like for like commodity. You are paying for the knowledge, experience, and judgment of the clinician planning and delivering your care. You're also paying for how thorough the diagnosis is, the technology used, the clinical environment, and the level of care and attention to detail throughout treatment. Now, at least in Ireland, orthodontic treatment can be provided by general dentists or specialist orthodontists. A specialist orthodontist completes several additional years of full-time training focused specifically on facial growth, bite correction, and long-term stability. Even within the specialty, there are differences in experience, approaches, and the depth of diagnosis. That's why fees can vary. And often, lower fees tend to reflect a more limited scope of assessment or treatment. So instead of focusing on price, it's more useful to think in terms of value. Orthodontic treatment takes time, so it's important to get it right the first time if possible. So rather than asking how much, ask who's planning my treatment, how thorough is the assessment, and how does this approach address the root cause? Because orthodontics is not just about straightening teeth. It's about achieving a result that is aesthetically pleasing, functional, and stable in the long term.